Hello, my name is Talisa Ramirez. I am in BSN 225. I am doing the interview questions for the alternate DFC program. I have all of my stuff written up here, so I'm going to be reading from my computer. I'm just going to talk about my recent experience at the DFC rotation for Maple Springs in Logan, Utah from October 23rd, 2023 to October 27th, 2023. I really had the chance to dive into the clinical nursing setting. During this time at the facility, I practiced various professional skills. I felt good about doing things like the peri-care and bathing the patients, but there's always room to get better. You know, in some areas I see that I could have done a bit more, like transferring, louder communication, and feeding patients. If I did get to go to this rotation again, I would better prepare myself with more practical skills, theoretical knowledge, and mental readiness. Being a part of this DFC has really helped me grow my professional skills as a caregiver now. I feel like I am better equipped to provide quality patient-centered care. Of course, there were some tough times during my shifts. One of the biggest challenges was the lack of communications between the interdisciplinary teams. At the DFC, there were several patients who, did tell the nurse sometimes that they refused. They didn't want the occupational therapy or the physical therapy that day. But the nurse was so busy that she forgot to relay that to the occupational therapist or the physical therapist. So when they came into the patient's room, the patient was upset, stating that they had already talked to the nurse about this. So I feel like to prevent things like this from happening, when a patient tells you something, you should really respect their wishes and communicate for that patient what they want. Advocate for that patient. Even though there were some hard times, getting through them made me feel sure of myself when facing similar situations. So as a caregiver now, when my patient refuses to take a bath, I know, they don't want to take a bath. That's their wishes. That's, they have the right to refuse. This DFC experience has been a big part in my personal and professional growth. I think it helped I think me having a good attitude and being a hard worker really helped during this DFC rotation. I hope others can learn from this DFC rotation. I would say one of the things that I would suggest to learners, would be to practice communication skills, peri-care, and mobility skills. I would say, looking ahead, I'm focused on making my nursing education even better for my next DFC. I plan to review all of my skills, all of my OMS, try to get in as much OMS practice as possible. And with my current profession now, I am getting some of the practice in, so I am ready for my next DFC. I feel better prepared. For my, one of the recommendations that I would say for Miss Lori Schwartz, I think that's how you pronounce it. She was the DFC professor at the Maple Springs. I would suggest just maybe like a better list of things that we're going to do for the day. So like if we're going to do baths or feeding, or just what we should expect or what we're going to be doing, I feel like it should be a list so we can better prepare for the next day. In closing, I am really happy for all the things that I learned in my DFC. They will stay with me forever in my nursing journey. I was excited at my DFC. It was a really nice experience. I really had a good time there. But thank you guys. Like again, my name is Talisa Ramirez. I am in BSN 225, and I am doing the interview questions for the alternate DFC.